Another common view is that testosterone causes angry, aggressive behavior. So it's very important that men not have too much testosterone because they get too aggressive. Well, the reality is testosterone can actually increase positive mood and decrease negative mood. The key here is making sure that the testosterone levels are at physiologic doses and in the bioidentical range. The link between testosterone and aggression is mainly for those people, including athletes, who supplement high levels of steroids and testosterone, and their bodies are obviously getting way too much, and it is affecting their behavior. But for the rest of us, low levels can actually, and going on testosterone therapy can actually enhance your mood and also the cognition or thought processes. This particular study in 2002, exogenous testosterone, aggression, and mood in eugonadal and hypogonadal men, they found that if testosterone was regulated to a physiologic dose, there was less depression and moodiness. The men had more energy, they were more sociable, more gregarious. Testosterone replacement therapy for low levels actually reduced aggression. And there was, for testosterone therapy, for normal levels showed no increase in aggression. And let's talk about growth hormone again. A common scare is that growth hormone replacement can actually stimulate cancer to grow. I mean, growth is growth, right? The growth hormone can actually stimulate a stray cancer cell to take off somewhere. Is this fact or fiction? Well, finally, a Oxford study that was done in 2006, they found that growth hormone replacement in children who were cancer survivors showed no evidence of new cancers, which is profound because these are children who, despite their prognosis, and given the growth hormone, they showed no evidence of new cancer growth. The study also showed recent surveillance of children and adults treated with growth hormone in general. There was no increase in observed risk of cancer. And now we'll move on to the adrenal function. Adrenal exhaustion promotes fatigue, not nervousness and irritability. Is this fact or fiction? We've all heard of adrenal exhaustion and how chronic fatigue can take place due to various causes. Adrenal function is very important to measure in functional medicine, and fatigue is one of the most common symptoms. But what about nervousness and irritability, anxiousness? Well, it turns out a study that was done quite a while ago in 1955, nervousness and irritability occurred in 86% of patients who had low adrenal symptoms and low adrenal function. So I always found this study interesting because we don't often think or equate nervousness with low adrenal, but it can occur quite frequently. course, fatigue is the number one symptom, and other symptoms include depression, apprehension, excessive weakness, lightheadedness, fainting or fainting spells, and also insomnia. Another relationship you may not be aware of is that age-related hearing loss has a lot to do with the adrenals. And we're currently doing studies here at Tahoma Clinic which correlate aldosterone levels with hearing loss in garden variety kinds of old age hearing loss. So aldosterone is a hormone produced by the adrenals which helps control sodium, potassium, and chloride through the cell membranes. But interestingly, as we age, a lot of times our adrenal function gets depleted, and the aldosterone reduces, which can make you more susceptible to hearing loss. So the aldosterone levels may actually have a protective effect on your hearing as we age. So I'd like to conclude our talk tonight, and I appreciate you all for coming. The bottom line is what we do with our hormones is keep it in balance. We want to copy nature's levels in health, and as long as we follow nature's direction in our hormone levels, we should stay in balance. This is John Sherman. Thank you for coming tonight, and I appreciate you attending our Tuesday night talks, and we will have many more. Thanks again.